Hey everyone, welcome to the Better Science, Better Health podcast with Gwen and Petra.
Hi Gwen, today we're going to discuss the latest Vital Health podcast, which is actually a best of. Dwayne selected two previous podcasts we've done. They are from October last year, so 2025. One was with Patrick Kelly, the other one with John Murphy. Both podcasts discuss generic shortages and supply chain risks. For everybody to understand the whole podcast, I think there's three things we need to explain. What are generics? What are biologics? And what are biosimilars?
Generics are medicines that are off patent. We'll say, for example, acetaminophen is a generic, and acetaminophen is also Tylenol. The brand name is Tylenol, and the generic name is acetaminophen. Basically, they're just chemically manufactured in a lab. And that's what a generic is. It's a small molecule. It's all made in the lab. A biologic is a more complex medicine that is made from living cells. And an example of a biologic that everybody kind of knows about is insulin. To make a biologic, it's almost like producing something in a controlled greenhouse, growing it from scratch rather than like making it chemically, So a biosimilar, because they're so complex, it's like a generic version of a biologic, but it's not exactly the same because of the fact that they're so complex. If you can think of like when you're growing a plant, each plant is a little bit different.
When they talk about supply chain and etc., I think it's important that we explain what an API is.
Okay, so an API is an active pharmaceutical ingredient. It's basically the thing that makes the medicine work, because everybody's trying to drive prices down, especially for generics. When they're manufacturing the active ingredient, they'll make it so that it only actually gets manufactured in one or two plants worldwide. That does make it cheaper, but it also puts constraints on the whole system. Let's pretend all the companies are pizza restaurants in a small town, and each one of these pizza restaurants needs dough, but they all have to get it from one spot because that's the cheapest way to do it. Well, then something happens, I don't know, hurricane, whatever, and it knocks out the plant that makes the dough. Well, then nobody's getting any pizza. All the companies are using that particular active ingredient. That is the ingredient that makes the medicine work. So it doesn't matter what company you are. Each one makes a different kind of pizza, right, as a different brand, but they're all using the same thing. If that's it, if there's only one or two manufacturers making it, then you're at the mercy of the manufacturer.
The fact that they are cheap could also become a huge risk, right? Because if the plant is not there, then it's not cheap anymore. Then you have to import it from somewhere else. Taking us back to the US. In the US, there is a thing which is called PBMs. And they are hugely involved in the distribution and reimbursement of drugs through the insurance, right?
Yes. PBM stands for Pharmacy Benefit Manager. And they're just like a giant purchasing organization that says, okay, we're going to negotiate prices here. And our clients are all the grocery stores, Walgreens, CVS, those are like PBMs, right? And we're like, yeah, we're going to negotiate prices with you saying we're only going to pay this much. So that's going to force manufacturers to kind of give it to them at that price, right? So this creates another possible issue anyways, because imagining that the healthcare system is trying to buy milk, let's just say, as cheaply as possible. The farmers are acting as like the generic manufacturers. The milk is the medicine, and the feed for the cows is like the API. Now you enter the PBMs. They're going to control access to the consumers. They have enormous buying power, right? Because they have all the grocery stores, for example. So we're only going to buy your milk at this price. So what happens there? At first, everybody would be happy because, oh my gosh, milk is so cheap. Well, then over time, the farmers are like, well, we can't operate on this. All the small farms are going to close, and they're going to have to, what we say, vertically integrate. So over time, there's going to be less smaller farms. There's going to be less cows, ultimately less milk.
With PBMs, generics, biosimilars, biologics, all of that explained. We hope you understand it all. If not, let us know in a comment. And we look forward to seeing you next time.
Bye, everybody.
Bye.